Hello, my name is Tamehrah. I'll be your student nurse today. How are you?
I'm fine. Thank you for asking.
Okay. Today I'll just be doing a physical assessment with you. It's basically a head to toe assessment. Can you just tell me your name and date of birth?
Kevin McIntosh, June 19, 1989.
Okay. Now I'm going to ask you a few quick questions. Can you tell me where we are today?
We are at the hospital.
Can you tell me today's date?
Today's date is October 1st, 2020.
Okay. Patient is oriented ×3. I'm gonna also ask you about do you have any ongoing pain or current illness?
I do not have any current pain or current illnesses.
Okay. All right. We're gonna start the head to toe assessment now. Okay. I'm gonna start by shining this light in your eyes. Okay. All right. All right, I'm gonna shield. Okay, then one more time. Patient's pupils are round, reactive, and responsive to light, indirectly. Okay, I'm just gonna pull that down. Conjunctiva is pink and moist. Sclera is white. I'm just gonna check your ears. Is there any tenderness when I touch your ears?
There's no tenderness when you touch my ears.
Okay. There's no redness on his right ear. There's no redness on his left ear. Patient also reports no tenderness. I'm just gonna look inside. There's light earwax in both ears. Now I'm gonna look at your mouth. Can you open your mouth wide for me? Okay, can you pull your lips down, your lip down? And your top lip, can you pull it up? Patient is not missing any teeth. His oral mucosa is pink and moist. I'm gonna check your nose now. Patient's nose is pink and moist. Is it tender to touch at all?
It is not tender when you touch my nose.
Okay, can you cover one nostril and take a deep breath? Okay, now with the other side. Does it feel pretty clear, easy to do that when you try to do it?
It does feel pretty clear and easy to do that when I try to do it.
Okay. I'm just going to check the back of your head for any type of redness back there. There's not any redness on the back of the patient's scalp. Okay. Okay, can you sit up? Can you take a deep breath for me? With a deep breath, patient's chest rises symmetrically with no lag and maximally. Okay, I'm just going to listen. Patient respiration rate is 17. His respirations are unlabored in moderate depth. Okay. Now I'm going to listen to your lungs. Okay. Can you take a deep breath for me? Another one. Another one. Another one. Another one. Another one. Patient's anterior lung lobes are clear throughout. Now, can you take a seat right there facing the couch? I'm going to listen to his posterior side. Okay, can you take a deep breath for me? Another deep breath. Another. Another. One more. Another one. Patient's posterior lung lobes are clear throughout. Now I'm going to listen to his left lateral side. Okay, can you, take a deep breath for me. And one more. Patient's lateral lobes are clear throughout. You can sit back facing the camera. Okay. I'm just gonna look at your arms. I don't see any bruises or lesions on his arms. They are brown with tan undertones. No bruises or lesions. This arm is brown with tan undertones as well. Can I look at your back? I just want to make sure there's no redness. Patient does not have any redness on his scapula or ribs or his back. The skin is dry and intact. His arms are warm, dry, and intact. Okay. All right. I'm going to grab your blood pressure. Okay, can I just put this around your arm?
Yes.
Okay, this is about 40% around. I'm checking the 80-40% rule. Okay. This is at about 80%. It stopped at 80. I will pump it up to about 120, 130. Patient's blood pressure was 110/70. That is within normal range. Okay. Now I'm just going to check a few of your pulses in your arms. Okay? Can you lay your arms straight? I'm checking the patient's brachial pulses. Brachial pulses are on the 2 out of 3 scale, bilaterally. They are at a regular rhythm and rate. Okay. Now I am checking the patient's radial pulses. They are also a 2 out of 3 bilaterally. The rate is regular. Now I am checking the patient's ulnar pulses. They are a 2 out of 3. Regular. Okay. Alrighty. Now, can I see your finger? I need to check your capillary refill. The capillary refill is brisk. Okay. Now I'm going to listen to your heart. Okay. I'm going to first listen to the aortic, at the aortic site. That is the second intercostal space down on the right sternal border. So 1, 2, it's about right there. I am listening at the aortic site. The S2 is louder than the S1. I do not hear any murmurs, rubs, or splits. The rate is regular with the regular rhythm. I am now going to go to the pulmonic site. That is on the left sternal border, second intercostal down. I am at the pulmonic site. S2 is louder than S1. The rhythm is regular with a regular rate. I do not hear any murmurs, rubs, or splits. Next, I am going to move on to the herbs site. That is at the left sternal border, the third intercostal space. S1 and S2 are about the same in pitch. I do not hear any murmurs, rubs, or splits. Next, I am going to move to the tricuspid valve. That is the fifth intercostal down, left sternal border. S1 is louder than S2. The rate and rhythm are regular. I do not hear any murmurs or rubs. Next, I will move to the mitral valve. That is the fifth intercostal space down, mid-clavicular on the left side. S1 is louder than S2. I do not hear any murmurs, rubs, or gallops. I am also going to get the patient's apical rate at this site. Patient's apical rate is 72. That is within normal range. Okay. Next, I'm going to look at your legs, okay?
Okay.
So you can put your legs up on here so I can look at them. Here, let me scoot that closer. Okay. Legs are brown with tan undertones. He does not have any redness on his knees. His skin is warm, dry, and intact. I'm going to take your socks off. Okay. Patient's feet are dry and intact. His skin is warm as well. I'm just going to check your capillary refill on your toe. Capillary refill is brisk. Okay. Now I'm going to check patient's posterior tibial pulses. They are on a 2 out of 3 scale. The rhythm is regular. Okay, I'm gonna check his dorsalis pedis pulses at the top of the foot. I'm trying to. They are also regular on the 2 out of 3 scale. There's not any redness or skin breakdown on his heels and ankles. Okay. I do not see any present edema on either leg. Okay. Now I'm going to push down and I need you to pull your feet back towards you. Okay, they're pretty strong. Okay, now I'm gonna push push down like a gas pedal. Okay. Patient's strength against resistance for his lower extremities are 5 out of 5. Well, for his feet, now I'm gonna push down. Can you raise your legs as hard as you can raise them? Okay. Now I'm gonna hold them up and you gotta push down. Okay. His leg strength against resistance is a 5 out of 5. Now, can I do that with your arms? I'm gonna cross my arms like, nope, you keep yours straight. Can you squeeze? And then I'm gonna push and you pull. Well, I'm pulling, yeah, there you go. All right, now you're gonna go against resistance. When I push towards you, yep, okay. Pretty strong. His upper strength is 5 out of 5 as well. Now, can you kind of relax your head back? Yep, and then can you look to your left? Can you turn your head? There's no JVD. He does not have a positive jugular vein distension. Okay, you can look straight. All right, I'm gonna also look at your abdominal area. Can you kind of straighten? You gotta come down some, straighten out some. We can not. You gotta lay down, yeah, but kind of flat. I know you can't get exactly flat, as flat as you can get. There we go. Okay. Yep. All right. First, I'm gonna look at his abdominal area. It can just go normal. Thank you. It is flat, round. I don't see any abdominal distension. Okay. I'm gonna listen to your abdominal for bowel sounds. Okay. Patient has active bowel sounds in all 4 quadrants. Okay, you can sit back up. All right, now I want to listen to your heart again. All right, I'm gonna feel your carotid pulse. Patient's carotid pulse is regular at a 2-3. 2 out of 3. Patient's carotid pulses are bilaterally regular on the 2 out of 3 scale. I'm going to correlate this. Okay. I'm going to listen listen at the mitral valve. Patient's S1 correlates with his carotid. Okay, can you put your legs back up? I'm gonna see how good your sensation to touch is. Now, put that back forward. Okay. When I touch you, can you just say yes? You can close your eyes. Okay. Can you say yes when I touch you?
Yes. I can tell you. Yes. 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 Yes.
Patient sensation to touch is intact. There was also one more thing I wanted to do. You can lay down a little bit more. I just want to feel your abdominal area. Okay. All right. Is there any tenderness?
There is no tenderness.
Okay. The skin on patient's abdomen is clear and intact. It is warm. There is no redness or lesions. Okay, you can sit up. All right. I'm gonna listen to your heart sounds with a bell. It just gives me a little bit clearer.
Okay.
Okay. I'm gonna start at the aortic site. It is the second intercostal space down at the right sternal border. I am now at the pulmonic site. It is the second intercostal space down at the left side of the sternal border. Next side will go one more intercostal space down at the left sternal border. That is the herb site. I am now at the fifth intercostal space down. This is the tricuspid site. And then I will go mid-clavicular. This is the mitral valve. There are no abnormal sounds listening to his heart with the